Welcome to the Woolwich Community Health Center, where we are dedicated to promoting health and well being within our vibrant community. We're excited to have you as part of our family, and this video is designed to help you navigate and make the most of your experience with us. Whether you're here for routine checkups, specialized care, or community programs, we're committed to providing you with personalized and compassionate services. Our team of dedicated healthcare professionals are here to support you every step of the way. Let's start with a quick overview of what you can expect as a valued member of our community. From the moment you walk through our doors, you'll be greeted by our friendly staff at the front. Those are our medical office administrators. They're here to assist you with any questions you may have and ensure you feel comfortable and informed. At Woolwich Community Health Center, we offer a range of services to meet your unique needs, from preventive care to screenings to specialized clinics and educational programs. Our goal is to empower you to prioritize and maintain your health. We're not just a healthcare provider, we're a community hub that fosters a sense of belonging and support. Our team is diverse and committed to creating a welcoming environment for everyone. We understand that each individual is unique, and we tailor our services to meet your specific needs. Beyond healthcare, we host various community events and activities that you're invited to participate in. These events are a great way to connect with neighbors, learn new things, and contribute to the overall well being of our community. Currently, there are 101 community health centers across Ontario, including 10 Aboriginal Health Access Centers. What makes the community health center model different? There are key differences within this model. For example, family health teams, or FHTs, are that they are NFP, which means all staff are salaried, including physicians. We do not bill OHIP per visit, which works well with our philosophy and means. For example, that a follow up visit is part of a good medical practice. And secondly, CHCs are governed by volunteer members of our community. We are a not for profit and community governed, and part of the KW4 Ontario Health Team. And being funded by the Ministry of Health through Ontario Health West means that we receive an annual operating budget, and also means that we are required to ask for some very specific information. This information helps us and the Ministry of Health to assess whether we are reaching the populations we need to be reaching and to show that we are serving our communities appropriately. Because there is recognition that things like language, income, and education all play a part in how successfully individuals achieve optimal health, we use the data from these questions to help with planning. So, we have to ask these questions, but you do not need to answer any questions which make you feel uncomfortable. The care you receive will not be affected, and all information is kept confidential. Any data we send or use does not have names or identifiers. We also have a focus on health promotion and illness prevention, not only through our primary care team, but also through our community team initiatives, which I will discuss later on. Our vision at WCHC is an active, connected community whose residents enjoy optimal health and vitality. Our mission is enhancing health and well being in our diverse and evolving communities in Woolwich, Wellesley, and Wilmot. Our values are holistic approaches in which we offer comprehensive, integrated, and accessible services and programs that focus on the physical, mental, spiritual, and social determinants of health. Respect and compassion, where we interact with individuals, families, and communities in a caring, friendly, inclusive, and compassionate manner. Partnership, where we build relationships with clients, volunteers, community groups, interdisciplinary team members, and other healthcare providers. Accountability and responsibility, where we are committed to ethical practice and good stewardship of resources, physical, human, and environmental. And communication, where we engage clients, staff, and the community through listening, information sharing, consultation, and outreach. Our approach is this: to achieve our mission, we are committed to sustaining and continuously improving the quality, safety, and effectiveness of our care, and competence and expertise of our staff and volunteers in delivering programs and services. At WCHC, we work at many levels of health promotion and activities that aim to improve the health of the population and prevent illness. We work with individuals to improve personal health and encourage healthy lifestyles through community education, nutrition counseling, farm safety presentations, and many more. We also work with communities to improve health, and one example is our youth councils, who work to inform decision makers of issues affecting youth and help plan activities for youth, such as youth leadership workshops, recreation, and volunteer opportunities. Lastly, we work to advise decision makers and promote healthy policy, which can result in healthier environments and healthier behaviors. An example of this would be the Together for Health, a regional program, working with regional staff and decision makers on health and the Built Environment Forum to ensure that we build communities that are health promoting and protect our farmland. Community programs are offered to anyone who lives within the broader catchment area, which means if you live in our catchment area, you are welcome to join a program in any of our sites. Most of our programs are advertised on our website, newsletter, and social media platforms. Here is a list of some types of professional staff we have available to you at the Health Center. Not only do we have physicians and nurse practitioners, we have clinical nurses, lab technicians, chiropodists, registered dietitians, psychotherapists and counselors, social workers, physiotherapists, community and rural health workers, health promoter, social navigator, hospice services, and medical office administrators, and more. Our team is continuously changing, adapting, and growing to meet the needs of our communities. We are an appointment only health center, not a walk in clinic. 20-minute appointments allow ample time to address multiple problems and provide health promotion and education. Reception determines length of appointment who, and who to book you with based on information you give them when booking the appointment. Non urgent appointments. These are limited in number of annual physicals per day and also includes prescription renewals. Prescription renewals. These requests can be made through your pharmacy and sending a request or by booking an appointment. Urgent appointments. We reserve a number of spots for same day appointments. Occasionally, you might get squeezed into a shorter appointment time slot to accommodate in these circumstances. And also, please call if you need to cancel your appointment. We also have care outside the office. This includes home visits, 24-hour on call, and hospital stays. We are able to provide limited lab services on Mondays and Tuesdays. By limited, I mean drawing blood for standard blood tests. It can be very busy first thing, right at 8:30. So we advise that if you do not require something like an FBS, you come later in the morning. For x-rays or ultrasounds, you will be referred to Kitchener, Waterloo, or Stratford, and the lab services are only for registered clients. So in St. Jacobs, we have lab services available on Mondays from 8:30 to 4:30 and Tuesdays 1 o'clock to 4:30. And in Wellesley, they are available on Tuesdays from 8:30 to 12 o'clock. Here is a list of some of the other programs and services that we offer. So we have our primary health team, chiropody, counseling, diabetes education program, dietitian services, farm safety, GFK, which is a program for low German moms and their children, health promotion, which encompasses a wide variety of different groups or one on one programs, physiotherapy, youth programs, assistance with Ontario Dental Program, fitness classes, and much more. Have a look in our newsletter to see what else we offer. Now I would like to introduce to you the community team initiatives who offer some of these programs. A health promoter at a community health center plays a crucial role in promoting and improving the health and well-being of individuals and communities. The specific responsibilities may vary depending on the context and the needs of the community, but generally, health promoters focus on the following areas: health education and outreach. A health promoter designs and implements health education programs to raise awareness about various health issues within the community, conducting workshops, seminars, and training sessions on topics such as nutrition, hygiene, disease prevention, and healthy lifestyle choices. Community engagement. A health promoter builds relationships with community members to understand their needs and concerns related to their health. And they also facilitate community meetings and discussions to involve residents in health promotion activities. Advocacy. Health promoters advocate for policies and practices that support community health and well being, representing the community in discussions with healthcare providers, policymakers, and other stakeholders. Preventive health services. Health promoters organize and promote screenings, vaccinations, and other preventive health services. They encourage regular health checkups and preventive measures to reduce the risk of disease. Resource mobilization. Health promoters identify and mobilize resources, including funding, volunteers, and community partnerships to support health programs. They collaborate with local organizations and businesses to enhance the availability of health resources. Cultural competency. Health promoters understand and respect the cultural diversity of the community and tailoring health promotion strategies accordingly. And they also address cultural factors that may impact health behaviors and outcomes. Individual support. Health promoters provide one on one support and guidance to individuals on health related issues, and they connect individuals with appropriate healthcare services and resources. Data collection and evaluation. Health promoters collect data on community health indicators and trends, and they evaluate the effectiveness of health promotion programs and making recommendations for improvements. Overall, the role of a health promoter is to empower individuals and communities to take control of their health by providing education, resources, and support. They work collaboratively with community members and other healthcare professionals to create sustainable and culturally sensitive health promotion initiatives. Rural community health worker and their focus on the community team is to provide health and safety, promotion, and education on the rural farming and agricultural communities with special attention to our priority populations. These events and programs are generally in the form of health days, farm safety days, specialty clinics, safety rallies, and other rural outreach opportunities. The rural community health worker works out of all three sites in St. Jacobs, Wellesley, and Linwood, as well as off-site. We also have our oral health peer worker, which provides support to people requiring information and assistance when applying for government programs that provide funding for dental care, as well as providing oral health education to schools and community groups. The Woolwich Community Health Center offers many fun and interesting art classes throughout the year. This free program provides adults a chance to learn something new, socialize with others, and take home a new creation. And over the past few years, we have created two community gardens here at the Woolwich Community Health Center. Our vegetable garden has been growing for 3 seasons now, and we grow an abundance of produce that we offer free of charge to anyone passing through our doors. Our new native plant pollinator garden is buzzing with bees and butterflies and has several benches so people can sit and enjoy the peaceful surroundings. Volunteers are greatly appreciated and are a vital part in keeping our gardens beautiful. Any extra vegetables from the garden are also donated to the local food bank. We also have a social prescribing here at our health center, which is a brand new role. Social prescribing allows your healthcare professional to connect you with a social navigator who can help you access local community supports based on your needs. A social navigator provides personalized care and referrals to community and social supports based on your individual goals and interests. It aims to help you take charge of your overall health and well-being. Social prescribing can help with things such as transportation, food security, social connection, and much more. Speak to your primary care provider for a referral to our social navigator. So these are just a few examples of the many initiatives that we have to offer from the community team. The WCHC provides space to community partners to help bring services closer to you. These include Waterloo Hospice, Canadian Mental Health Agency, Community Airways Clinic for Asthma and COPD, Alzheimer's Society, and Community Diabetes Program of Waterloo Region. Our catchment area, or in other words, our job, is to provide services to Woolwich, Wellesley, and the north part of Wilmot. If you have any questions about the catchment eligibility, feel free to speak to one of our medical office administrators. Now let's talk about privacy in the context of health. I want to shed some light on the Personal Health Information Protection Act, or PHIPAA, a client-centered legislation designed to ensure a consistent set of privacy rules are applied to all individuals. At the heart of PHIPAA is the recognition that your personal health information is just that, personal. It empowers you, the patient, and your substitute decision makers to have control over how your health information is collected, stored, and disclosed. PHIPAA provides a framework where patients and their substitute decision makers play a vital role in decisions regarding their health data. You have the right to know who is accessing your information and for what purposes. The legislation ensures a transparent and accountable process, allowing you to trust that your sensitive health information is handled with the utmost care. PHIPAA is about putting control back into the hands of every individual. It's about respecting the privacy and dignity of every patient we serve. At WCHC, we are committed to upholding the principles of PHIPAA, and your trust and confidence in our services are paramount, and we want you to know that your privacy is in safe hands. I want to also tell you about your trusted health information custodian. At WCHC, we take our responsibility seriously to ensure the safety and integrity of our patients' personal health information. A health information custodian recognizes the importance of safeguarding the sensitive information entrusted to us by our patients. It's not just a duty, it's a commitment to the privacy and well being of each individual we serve. This responsibility is a shared commitment with our dedicated staff, those authorized to handle the personal information that our patients entrust to us. Working at WCHC, we understand the gravity of handling personal health information. Our training emphasizes the importance of confidentiality and the ethical responsibility we carry as custodians of this sensitive data. At WCHC, we want you to rest assured that your personal health information is in capable hands. Your trust is our highest priority. At WCHC, we believe in putting you, the patient, in control of your personal health journey. That's why we want to ensure you are aware of your rights regarding your personal health information, or PHI. You have the right to give, refuse, or withdraw consent to the collection, use, and disclosure of your PHI. Your consent matters, and we respect your choices when it comes to your health information. Additionally, you have the right to request access to your PHI. We believe in transparency, and we want you to be informed and empowered in managing your health records. If you ever notice inaccuracies, you have the right to request corrections be made in your health records. Your health information should accurately reflect your journey, and we are here to ensure its integrity. It's essential for patients to know who has accessed their health information. You have the right to be informed, and we are committed to providing you with that transparency. At WCHC, we hold a sacred commitment to maintaining the privacy and integrity of every patient's personal health information, or PHI. Our staff understands the importance of your trust, and they are dedicated to upholding the highest standards when it comes to handling your health information. It's a fundamental principle that our team only accessing the records of patients to whom they are providing direct and current patient care. This ensures that your information is handled with the utmost care and relevance. Our commitment extends to accessing only the information necessary to perform their duties. Your privacy matters, and we want you to have confidence that your information is only in the hands of those who genuinely need it. We believe in fostering a transparent and caring relationship with our patients. One important aspect of this relationship is the concept of implied consent. Implied consent is assumed to ensure that you receive the best possible care and support. It involves three key elements. First, it covers providing care and treatment. When you seek our services, we assume your consent for the necessary care and treatment to promote your well being. The second element involves sharing information among healthcare providers involved in your care. This collaboration ensures the provision of safe and effective care, creating a network of support tailored to your needs. Lastly, implied consent allows us to collect information to meet our legal and funder requirements. This ensures compliance with regulations, enabling us to maintain the highest standards of care. We value your privacy and understand the importance of confidentiality in your healthcare journey. This is why we adhere to a strict policy regarding the release of information outside of the circle of care. For any release of information to individuals or agencies outside of your circle of care, such as lawyers, insurance companies, or employers, a crucial step we follow is obtaining written consent. This written consent ensures that your personal health information is only shared with entities you explicitly authorize. Written consent is a fundamental element of our commitment to safeguarding your privacy. It gives you control over who has access to your health information beyond the realm of direct care providers. We believe in empowering individuals of all ages to actively participate in their healthcare decisions. It's important to note that when it comes to consent, age is not the determining factor. Unlike some misconceptions, there is no fixed age of consent here. Instead, the ability of an individual to provide consent is based on their capacity, not their age. This means that even an individual under the age of 16 may provide consent if they possess the capacity to understand the implications and consequences of their decisions. Our approach is centered around respecting the autonomy of every individual. It's about ensuring that everyone, regardless of age, is an active participant in their healthcare journey. We take the time to communicate with our younger patients, making sure they understand the information and feel comfortable expressing their preferences. Your privacy is of the utmost importance to us. If you ever have a privacy concern or if you wish to access your health information, we're here to guide you through that process. If you have a privacy concern, the first point of contact is our dedicated privacy officer. They are here to address your concerns and ensure that your privacy is protected. Should you wish to access your health information, a simple step is to make a written request to the privacy officer. This ensures a secure and confidential process. We're here to make the process as seamless as possible. Your privacy matters, and we're committed to assisting you in accessing your health information while maintaining the highest standards of confidentiality. Ideally, when accessing this information, it's recommended to review it with your healthcare provider. This collaborative approach ensures that you have a clear understanding of your health information. I want to also let you know that we are on social media. Feel free to follow us on whichever platform you use, where we will make posts about updates of our healthcare center. We are on Facebook, Instagram, Twitter, and LinkedIn. As we come to the close of our presentation today, I want to extend a heartfelt welcome once again to all of our new clients joining the Woolwich Community Health Center family. We hope this session has provided you with a glimpse into the warmth and dedication that defines our community. At Woolwich, we're not just a health center, we're a community that cares deeply about your well being. Our doors are always open, metaphorically speaking, of course, we're not open 24/7, and our team is here to support you on your health journey. We encourage you to take advantage of the various programs, services, and events we offer, tailored to meet the diverse needs of our community. We believe in the power of community, and we're excited to have you as an integral part of it. Your health is our priority, and we are committed to working together to create a healthier and happier community for everyone. Once again, welcome to the Woolwich Community Health Center. We look forward to getting to know you better and supporting you in your health goals and building a stronger and healthy community together. If you have any questions or need assistance, don't hesitate to reach out. Your well being is at the heart of everything we do. Thank you for choosing the Woolwich Community Health Center. Here's to a journey of good health and community connection. Welcome to the Woolwich family.